Hello everyone, welcome to the clinical case from this week. We will have a 4-year-old male neutered boxer that presented with 5-day history of what the owner reported being an abnormal eye on the right eye. So what they saw is this abnormal position of the eyeball relative to the orbit, and also they saw an abnormal pupil size, so they saw an anisocoria. So when we evaluate the dog and perform the neuro exam, and again what you don't see on the videos because it's normal, we have normal menas response on the right and on the left. And when we evaluate the direct PLR on the right eye, it was decreased to absent. However, when we put the light on the left, we saw there was a little bit of iris atrophy, but still could see a good reflex to the light. And there was not any reflex on the right eye when we put the light on the left, so we don't have direct or indirect on the right eye. And there was a decreased vestibulocular reflex slightly when we're moving the head towards the right. You could see that right eye was not really following the normal movement that you would expect on the vestibulo-ocular reflex. So to summarize the findings, what do we have? So we have, based on the signalment, the 4-year-old male neutered boxer with this 5-day history of this abnormal eye. So he had this dorsolateral static extravismus on the right eye. He had internal ophthalmoparesis, so it was a pupil that was not really responding to the pupillary reflex, direct or indirect, on the right eye. And what now we have to think of is where is your neurolocalization based on this information. So with this anisocoria, with the abnormal pupil being dilated that did not respond to the light stimulus on the right eye, and this abnormal position of the eyeball relative to the orbit. So we have this dorsolateral static strabismus. So think about the neurolocalization, but also we have to think about list of differentials. So based on the clinical reasoning, we have this 4-year-old male neutered boxer with acute, not really progressive what the owner report, lateralized, non-painful, and where is your neurolocalization? So let's think about the list of differentials, and you will have the answer based on the advanced imaging that will be reported by Fraser at the middle of the week. And then by the end of the week, we will discuss the neurolocalization, the list of differentials, and the outcome on this particular case. Thank you so much.